So, back in January, when we were starting to plan this conference, this summit, we actually were listening in the office to a Senate subcommittee testimony on primary health and aging, with a focus on the primary care workforce. And one of the panelists was Dr. Claudia Fegan, Chief Medical Officer at Cook County Hospital. And at Cook, Dr. Fegan sees thousands of patients who've been referred from other hospitals essentially because they don't have insurance. And as we listened to this testimony, she chronicled the daily routine at her hospital, where patients were coming to the ER essentially because they had no place to go. And it was really a beautiful testimony. And I want to encourage everyone here to listen to it. And at the end of her testimony, she proclaimed that this is wrong. This is an injustice in completely clear terms. And she talked about how she had made a choice that day, as well as days and weeks before that, to bring the voice, to bring the perspectives of her patients to DC and advocate on them herself. And there we were in our office, a group of clinicians and trainees who are committed to harnessing values and passion about healthcare, bringing it into the public space, and getting people to take action together. And there we were listening to someone who's been doing that for a long, long time. Dr. Fegan is a former member of the National Health Service Corps. She's the past president of Physicians for a National Health Program. And she's also a daughter of former labor organizers and social workers. So community building is something that I think is pretty familiar to her. So we're incredibly delighted she's come to share her perspectives with us, choices that she's made, and help us understand how clinicians and trainees can be playing an important role in public life. Thank you so much.
Wow. So I've been advocating for our patients for 30 years. But I'm actually a little nervous about speaking to you today because I've been telling stories for all this time, and you guys have been schooled on telling stories. I feel that's a more difficult assignment for me. So, as I was thinking this past week, so what do I say to primary care leaders and future leaders? What message could I bring you? Well, first of all, that you can lead, and that if you choose to, you will lead. And I just told someone the story. I have 2 children, and my son is a writer, and my daughter is a artist. So you can see they decided. They look at Mom's way of life and said, no, I'm not going to do that. But my son graduated from the University of Notre Dame with a degree in history. And I remember going to I actually remember when he told me he was going to major in history, and I said to him, what's plan B? But I went to the convocation, and the chairman of the Department of History said, okay, moms and dads, I know you were a little concerned when that son or daughter said to you, I'm going to major in history. And he says, but on this beautiful campus, we have a school of engineering, we have architecture, and I'm going to tell you that those engineers are going to be working for your history major. And that's sort of the way I feel about primary care. When I was a resident, there was a tradition that you got invited down to have a conversation with the chair. And our chair was a man by the name of Jordan Cohen. We used to call him Jordash. But Jordan Cohen went on to become the president of AAMC. But Jordan invited me down for my conversation at the beginning of my 2nd year. And so he said, so what are you going to do with yourself? I said, I'm going to finish my residency here. I trained at Michael B. Hospital in Chicago. And I'm going to practice medicine on the south side of Chicago. And Jordan cleared his throat, got a little, shifted in his chair. And, he looks at me. And this was the early 80s, we'll say. He says to me, well, Claudia, you know, you're a very bright girl. I was one of only 2 black residents at Michael Reese at the time. And as a child, I had been admitted to a segregated ward at Michael Reese. And it was part of the reason I wanted to train there. Because I knew that if I was black and I wanted to practice medicine at Michael Reese, which was very esteemed in my community, that the only way to get a job there or to be able to admitting privileges there as a black physician was you had to train there. There was no way you could be from the outside and you were going to get there. So my dream was that I would get a residency there. And he says, you know, you're really a bright girl. And I'm thinking, you know, a little expletive, how dare you call me a girl? But he said, we could get you a fellowship anywhere in the country. We could get you a fellowship. Do you want to go, you know, to California, or you want to go to out east? Our residents are very sought after. And at that time, 90% of the people who finished in that program went on to fellowship. And the only reason he could conceive of that you wouldn't go on to fellowship was because there was something wrong with you. And I said to him, thank you very much, but I'm going to practice medicine on the south side of Chicago. And, you know, we had other conversations after that. But I was always very clear about what my goal was and what my intentions were. Neither of my parents were born in the United States. My mother was from Germany. She's Jewish. And she fled Nazi Germany in 1939. Now, in 1939, Jews couldn't really get out of Germany. But fortunately for her, you know, her father was actually from Belarus. And they were able to immigrate to the United States under the Russian immigration quota. And that's because my grandfather was a very determined man. He was a watchmaker. And he couldn't believe, after having immigrated from Belarus to Germany and working his skill, working his profession as a watchmaker, that he would have to leave this country. He loved Germany. He loved Germany so much that when Germany went to war in World War I, he joined the army. And he was captured as a prisoner of war in World War I. And he was imprisoned in a Russian prison for prisoners of war. And he was able to steal an officer's cap. And he took his cellmate, and they escaped. And they walked across the Russian front back to Germany. And he was awarded the Iron Cross, which is the highest award that the German army gives. So when the Nazis came to take him and my uncle to the concentration camp, he was a man of few words. He got up, he walked across the room, he went over to the mantel, he got out the box with his Iron Cross and he put it on the table. And they left. Now, he wasn't a stupid man. He knew the next time they were going to send somebody who wouldn't care about his cross. And so he made passage for his family to leave Germany. But it was very hard for him to accept that that would be their fate, that they would have to leave. But he, you know, he instilled within his family, you know, that with hard work and determination, you could get where you wanted to go. So, my father was from Jamaica. And his mother had 13 brothers and sisters. And all 14 of them decided that America was the land of opportunity. And the men in that family had a skill. They were carpenters. And they decided to come to the United States and make their fortune in New York. That they could apply their skills as carpenters. And the United States was the land of milk and honey. They could make a lot of money. They would go back to Jamaica and do well. So his mother brought him, and they moved off. They came to New York. And the only problem was that when everybody was ready to go back to Jamaica, his mother decided, oh, I like it here. I'm going to stay here. So everybody else went back, and I go back to Jamaica. The kids are so used to Jamaica now, they don't even ask. When they were small, they didn't ask if we were going to Jamaica this year. They asked, when are we going to Jamaica? And we have a compound there, all the houses that they built, like, I think of it like the Kennedy compound. We have the Davis compound, and we go down today. But, so where would my mother and my father meet? Well, in the cafeteria of NYU, of course. And it was not a good time for a Jamaican man and a German immigrant, let alone a Baptist and a Jew. So I celebrate the Baptist-Paseo combination. Not a good time for them to be a couple. So my father served in World War II. And he came back from World War II and he thought, GI Bill, great idea. So he would go off to the University of Pennsylvania. My mother went to Bryn Mawr, and they thought, well, maybe Philadelphia would be a better city for them. But that wasn't a very friendly city either. So they came to Chicago and made a space on the south side. I'm a theater buff. My father became very proficient in literature. He liked to tell stories when we were children. And so I didn't realize till later in life that many of the stories he told us were Shakespeare. And so I think about, just a couple weeks ago I came back from Shakespeare Festival in Ontario. And one of the things they showed, aside from Shakespeare, was Fiddler on the Roof. And there's a line in Fiddler on the Roof where the daughter is going to leave the family. She's going to marry a Polish Catholic. And she's like, Papa, we love each other. And Tevye says to his daughter, a bird and a fish may love each other, but where will they make a home? And my response is on the south side of Chicago, very nice. So Andrew asked me to tell you about how I found my voice, how I learned to speak about this. Because the issue, we do not have a just health care system in the United States today. And the issue is, how do we get a just health care system? What are we going to do about it? And when did I go from deciding that being a physician and taking care of patients was a wonderful thing to do? And I will tell you today that taking care of patients is one of the most fun things I do. It is a privilege to be allowed to sit and witness of patients as they allow you to invade their personal space and they tell you their most intimate concerns, their troubles. And then if there's something you can offer them that lightens that burden, it is a wonderful thing. But at some point, for me, I realized that I could take care of one patient in a room and have an impact, have an outcome. And then, if I could have a say about what was happening in the other rooms in the clinic where I was working, or if I could have an impact on what was happening in the other clinics around the city. That I could have an even bigger impact if I could reach higher. And it wasn't naturally intuitive that I would be that person. That I could be the one who would be in charge. There have been lots of times in my life where it was clear to me that I might not necessarily rise to the top or be selected to be the one in charge. But I was really committed to the notion that our patients have a need, and someone has to speak up. Someone has to address that need. And from the time that I went to medical school, I had this notion that if you had initials after your name, if you were a physician, you were a regarded or esteemed member of society. And just by being a doctor and walking in and speaking about an injustice, more people would listen than if you were just a patient. And that's not to diminish a patient by any stretch of the imagination. But patients have lots of challenges. And the patients that I take care of have even more challenges. Maybe they don't have any place to sleep tonight. Maybe they're not going to be able to feed their children. The last thing that they have time for is to say that this is not right the way you're treating me. That I need more. If you're busy fighting for every bit you have, to take time to say, I need help, is energy you may not be able to afford. So I didn't start off working in a place that would take me there. Because when I went to medical school, I was rather insecure about it. You know, I was kind of worried about whether I'll get through it. I went to a school that wasn't very warm and, you know, nourishing. And minority students were like, you're just lucky to be here. But I realized the fact that I got into medical school was an opportunity I had to take advantage of. Why is that? Why is it that I decided that this was so important and something I could do? I'm not going to tell you it's because there was someone who was sick in my family who benefited from the medical care. I'm not going to tell you it's because, you know, someone close to me suffered needlessly. I'm going to tell you because my parents taught me something about social justice. That not everyone can speak, not everyone can do. But if you find that ability, if you find that one thing, if you can speak in a room and people will listen, there's an opportunity there. My dad used to organize workers. He was better educated than the workers he was trying to organize. But he could organize workers because he recognized if he could get them to pool their resources, that together they were a force. And he taught them that they could effect change. They could demand from their employers that they had to honor their rights. So I remember he used to work with longshoremen. And those were big, scary guys. But they weren't treated fairly by their employers. And if the employers, they say, you know, we need to have, you know, a break for lunch. And the boss said, no, you know, we got to get these ships unloaded, and We have to move so many crates a day, and you have to figure out, well, what if none of us will move? What if all of us are going to decide that nothing is going to move until you honor our rights? That was powerful stuff. And I used to sit in the living room and watch him turn these guys around. And I used to watch him say, you know, you can do this. You are more powerful than the man with the money. And there is dignity in all work. And they must honor that dignity. You can do this. That is what the opportunity is for physicians as well. You see people in their most vulnerable times, and you understand their needs. You can speak to their needs, and you can help them effect change. It is the most important thing we can do. It is the most urgent thing for us to do. And the reason why primary care physicians have to do this is because there's no one who is practicing primary care who is making the decisions about what kind of health care system we will have in this country. The policy experts, the legislative aides, the congressmen, the senators, they have not been in the exam room. They have not been to the bedsides of our patients. And they can't speak to their needs. There's a wonderful book called The Heart of Power. And it's about how every president, from Roosevelt, and I'm talking Theodore, through Clinton, has attempted to change health care in this country. And they've all tried it because illness, misfortune, crosses all socioeconomic barriers. Nixon had a brother who died of tuberculosis. Dwight Eisenhower was moved by the stroke that took Mamie's father. The Kennedys were moved because when Joe Kennedy had a stroke and they had to pay for him to have around-the-clock care, they realized, no, most people don't have that kind of money. What would someone else do if they had a family member disabled like that? But there's so much money involved in health care in this country. There are such powerful forces at work, so solidly invested in the status quo, that serves Wall Street better than it serves our patients, that it is virtually impossible to get a piece of legislation. Well, right now it's possible to get any legislation, but to get a piece of legislation that would reform health care through Congress. Realize that healthcare lobbyists spent $1.4 billion in 2009 on lobbying efforts. Realize that big pharma, the pharmaceutical industry, in 2009 spent $1.4 million a day in 2009, trying to ensure that we wound up with a piece of legislation that would continue to meet their needs. So you may say, well, what chance do we have? How can we hope to have any influence over that process? Well, I'm going to tell you. remember. So obviously, I'm a black woman who became the president of medical staff of a hospital that admitted me to a segregated ward. I don't believe in impossible or unfeasible. Don't tell me something's politically unfeasible. The fight for healthcare justice is an issue of social justice. And social justice issues are never won on the floors of Congress. These are grassroots movements. The civil rights battle, that was fought in living rooms. When people saw Bull Connor, a racist sheriff, turn fire hoses on black college students and set dogs on them on the 6 o'clock news. That's how we got the Civil Rights Act. The war in Vietnam. I was in my first march against the war in Vietnam when I was 11 years old. I got spit on by a vet. But when people saw what we were doing in Vietnam, and young people began to march in the streets in huge numbers, and it came right into their living rooms, we got change. And what I'm telling you is the problem with healthcare in this country is we keep trying to fight it in the boardrooms and fight it in the legislatures. And the place that we can be most effective is in the streets. That when we tell our story, when we tell our patient stories, and when we talk to people about what's wrong with healthcare in this country, we will make a difference. Cook County Health and Hospital System, and just since I think I spoke before the Senate committee in January. In February, I became the executive medical director for the entire health and hospital system. It's not because I play nice in the sandbox. And it's not because I'm everyone's image. I know when I walk into, last night, I flew in here last night, I was on a plane, and you got that message, is there a doctor on the plane? And I rang my bell, and the stewardess came over, and she said, is there a problem? I said, I'm a physician. You know, I'm not who they expect. But I don't ever let that bother me. You know, my father said to me, you know, Marcus Welby, you ain't. I said, Dad, nobody believes that I'm the doctor. He said, just be what you are. And I think that's the most important thing. The two things, he taught me a lot, but there are two very important things he said. Be who you are, and being right isn't enough. So the cause to get justice in this country for our patients is the right thing to do. But that's not enough, because there are forces at work that are much more powerful, and they require the narrative that only you as healthcare givers can provide. They require the narrative, they require the leadership that you, who go to the bedside and take care of patients, and that doesn't mean whether you are an MD, a PA, a nurse, an APN, it requires the narrative you can give. Because you're powerful. You have to understand how powerful you are. So, you know, I'm obviously standing here telling you that I'm not happy or not satisfied with the ACA, the Affordable Care Act. I'll tell you that I live less than 2 blocks from Barack Obama. That, you know, we attend the same meetings when he was a state rep and when he was a senator. That we are acquainted with each other. I'm president of another organization called Health and Medicine Policy Research Group. He used to come annually to our events. But even he knows that the ACA will not meet the needs of our patients. While it is true that 25 million people, 25 million more, will be insured as a result of it. By the time it's fully implemented, there will still be 31 million people who are uninsured in this country, and that's not acceptable. 80% of those people who will be still uninsured will be U.S. citizens. I mean, that seems to worry some people. I say that you have to take care of everyone in your border. Now, I'm going to tell you that Cook County Health and Hospital System, we take great pride in the fact that we take care of everyone who comes in the door, regardless of their ability to pay or their origin. And that's why a lot of people come work for us, because that's the way they should be. That they can just apply their craft as taking care of people as opposed to being worried about what their insurance status is. You know, with the ACA, there are going to be 50 million Medicare beneficiaries who will be able to get preventive services that maybe they couldn't get before. But there will be up to 90 million people, there will be up to 90 million people who won't have to pay co-pays for preventive services that they may go without. You know, why is it that we have people in this country who have insurance and don't get pap smears and mammograms or colonoscopies? And it's because they may be insured, but they're inadequately insured. With the ACA, we're going to see an increased number of people who are underinsured. And that worries me. With the ACA, blacks and Latinos will be disproportionately represented among the uninsured. More than 4.3 million children and 1 million veterans will remain uninsured. And a 56-year-old who makes $46,000 a year will pay a premium for health insurance of over $10,000. And whether through co-payments or deductibles, could still spend over $6,000 on their care. It doesn't make sense that the richest country in the world, the most powerful country in the world, marches all over the world telling other countries how they should govern, telling other countries how they should lead, and we don't guarantee access to health care for every single person in this country. It doesn't make sense. And whenever someone tells me that immigrants shouldn't be covered, my question is, when was the last time you ate out? Did you look in the kitchen? Who prepared that food and who washed those dishes? And if you think that you can get away with now covering immigrants, then you don't understand how TB is transmitted if you ride public transportation in this country. If you read the newspaper this morning, drove here in a car today, ate a box of cereal, you paid more for it because this country does not have a just health care system. And it is our obligation, our responsibility, to advocate for our patients and to fight for health care justice in this country. I talk about our patients every day because the strength that they show just strengthens my commitment, renews my fervor to try to get them something better. I am so excited to see this group of folks here today. I am so impressed with the training you're getting, because I know that in this room are the foot soldiers that we need to make this cause right, to get universal health care. Barack Obama worked really hard. You know, he disappoints me, but all politicians do. But he did something that many before him had not done, He dragged a piece of legislation across the finish line. Because it is an imperfect piece of legislation, does not mean that we should stop fighting. And does not mean that we have to wait another generation. So, I'm a past president of Physicians for a National Health Program. We advocate for a single-payer universal health care because that legislation says that everyone should be entitled to health care. And it says we spend enough money on health care, we just let too many people who take profit from it, too many people who don't provide any care take profit from it. And not enough of that money goes to delivering the care. So if you take care of patients and you wrestle with the paperwork from every different insurance company with their different ways of collecting, their different ways of deciding how you should get paid for what you've done, then you ought to understand the simplicity of just saying, I just want to take care of patients and at the end of the day, make a living that will allow me to take care of my family. And not have to worry about if you check that box or dotted that I, crossed that T. And I think we can get there. I know we can get there. But we have to be willing to do the other work. So yeah, it's not enough that you're busy all the time. It's not enough that you have to take care of the kids, you have to pay the bills, and you have to take care of your patient, you have to check on their result, and did you call this specialist to find out if they knew anything about this condition, and then at the end of the day, oh yeah, we need you to go out there and fight for healthcare justice. My kids, my daughter makes my PowerPoint slides. She got a BFA from Parsons School of Design in New York, but I can still call her up and say, Angela, I'm talking to women next week. I'm talking to now. I need you to give me some slides that are going to really punch it so all women know that that's their cause. Okay, Mom. I'll send it to you. Yeah. You know, there's that whole thing about, and I hate that phrase, you know, if you have a job that needs to get done, give it to a busy person. I'm going to tell you something. You know, no offense, guys, but Mom's got this down. You know, I wasn't really good at that. I didn't play with dolls when I was small. You know, the motherhood thing, wasn't sure I was going to do that well. But, you know, after I managed answering a page while braiding the hair and getting the breakfast on the table and everybody out to school and we're on time, I got this down. And you will too. Because you wouldn't be here. You wouldn't have gotten this far if you couldn't organize. And you'll be successful in that endeavor. So, I have 2 lessons for you. One, you know, obviously I'm an advocate of HR 676, which is a single-payer piece of legislation that John Conyers has entered for every Congress for the last almost 20 years now. John Conyers is a patient man, but he's 88. John Conyers first proposed Martin Luther King's birthday as a national holiday in 1964. And he kept entering it every year until it happened. Every year. So he got stuck on single payer a few years ago, like 20 years ago. And I think we'll get there. I am really proud to have you guys join in the struggle to speak for our patients. I know that all of you have the capability to be leaders. And it's like that history major who's going to be telling those engineers what to do. You will be leaders in your areas as well. And I thank you for the opportunity to speak to you.